Advancements in technology have dramatically affected healthcare over the last few decades, leading to more accessible and innovative care for patients and their families. Today, we'll look at two ways community is meeting patients' needs quickly and more efficiently in our new segment, High Tech Healing.
The emergency department can be one of the busiest areas of any hospital, and as Clovis Community Medical Center has grown, they've needed to make some upgrades to meet the demand.
In 2022, we completed expansion of Clovis Community Emergency Department. We added a lot of additions, so we opened a red zone, expanded our lobby and our triage area, but also this EMS triage and radio room.
That higher volume of patients meant the ED needed to improve communication and sought out a grant from the California Department of Public Health.
We got the radio set up, put in last summer. Which was super exciting as our old system was very antiquated, and this one gives us the ability to field more calls and kind of streamline the process.
This new equipment has resulted in a noticeable improvement in care.
The new technology is just a support, it's a support equipment or technology that optimizes our ability to, get those patients in, get them triaged, and then move them to the designated area that they need to go to.
They even launched a dedicated medical channel, improving handoffs between EMS and the ER and speeding up response times for heart attacks and strokes.
As we evolve our stroke and STEMI, we implemented a reperfusion nurse back in December to help close the gap for target times for treating STEMI patients or, heart attack patients, so getting them to the cath lab, and then also the stroke patients.
And that is being recognized. Community stroke teams were recently honored by the American Heart Association for commitment to delivering life-saving care faster and more effectively.
It just makes things run so much smoother to have that notification and a minute to get things ready and, have your team set up as opposed to, trying to scramble and move things around and not be prepared.
And in downtown Fresno at Community Regional Medical Center, the cardiology department is focusing on reducing patients' turnaround time to get them home as quick as possible.
The turnaround time on an echocardiogram and the length of stay of a patient are very well correlated. So as we are able to reduce that turnaround time, we also assist in the reduction of the length of stay of a patient.
In order to reduce this turnaround time, the cardiology team identified key challenges and have been creating solutions for each. First was improving communication to help prioritize patients.
The escalation process wasn't really there. We didn't know who was going to be leaving the hospital before the next person, so we didn't know who to prioritize.
A group chat was created to help a patient's care team share information with each other and problem solve in real time.
When a patient is identified as leaving the hospital shortly but requires a thing like an echocardiogram, they are able to reach out to what we call the command center, and then from there it gets dispersed to whatever group is the barrier to discharge, and then we are able to expedite that patient specifically.
And they're finding ways to improve the space that they have and create specialized areas designated for testing.
In order to be more efficient at the echo specifically, it's been found that sonography does require a very specialized area to perform their studies in.
Thanks to the team focused on identifying and solving these challenges, they're already seeing results.
They absolutely have been successful. So community is really good at maintaining metrics, and we have seen probably about an 80% decrease in our turnaround times in echocardiograms over the past year and a half or so, which correlate to length of stay decrease as well.
From improved imaging to faster EMS response, these challenges are transforming patient care at Community Health System, making sure patients are treated quickly and safely.